Join me as I tackle the challenges of breastfeeding after a C-section and share what to expect along the way. In this video, you'll learn what to expect when breastfeeding after a C-section, including tips and strategies to make the process smoother. Breastfeeding after a C-section can be tough, and many mothers struggle to get started. This is because a C-section can make it harder to breastfeed, especially in the early days. You may feel exhausted, sore, and overwhelmed, which can make it difficult to establish a good breastfeeding routine. On top of that, you may have to deal with physical limitations, such as numbness or tingling in your breasts, which can make latching and feeding challenging. It's common to feel frustrated, worried, or even guilty if you're having trouble breastfeeding. But here's the thing. You're not alone, and with the right support and guidance, you can overcome these challenges. One of the biggest obstacles to breastfeeding after a C-section is the physical recovery process. You may have to deal with pain, swelling, and bruising, which can make it hard to hold your baby, let alone breastfeed. You may need to take pain medication, which can affect your milk supply or make you drowsy, making it difficult to feed your baby. Additionally, you may have to navigate a longer hospital stay, which can disrupt your breastfeeding routine and make it harder to establish a good latch. Another challenge is the emotional toll of a C-section. You may feel anxious, depressed, or traumatized after a C-section, which can make it hard to bond with your baby or feel confident in your ability to breastfeed. You may also feel like you've lost control over your body and your baby's care, which can be really tough to deal with. But here's the thing. Breastfeeding can be a powerful way to bond with your baby and regain a sense of control over your body and your baby's care. It's essential to remember that breastfeeding is a journey, and it's okay to take it one step at a time. You don't have to have all the answers right away, and you don't have to do it alone. Reach out to your healthcare provider, a lactation consultant, or a breastfeeding support group for help and guidance. They can provide you with personalized advice, support, and reassurance, which can make all the difference in your breastfeeding journey. When it comes to breastfeeding after a C-section, proper positioning is key. You'll want to find a comfortable position that works for you and your baby, which may take some experimentation. You may need to use pillows or a breastfeeding support to help you get into a good position, especially if you're feeling sore or uncomfortable. Remember, the goal is to find a position that feels comfortable and relaxing for both you and your baby. Managing pain is also crucial when breastfeeding after a C-section. You may need to take pain medication, use heat or cold therapy, or try relaxation techniques like deep breathing or meditation to help manage your pain. It's essential to communicate with your healthcare provider about your pain levels and any medications you're taking, as this can affect your milk supply or your baby's behavior. Having a strong support system is vital when breastfeeding after a C-section. This includes your healthcare provider, a lactation consultant, your partner, family, and friends. Don't be afraid to ask for help, whether it's with feeding, changing, or just holding your baby. Having a support system can make all the difference in your breastfeeding journey, and can help you feel more confident and empowered. One of the most important things to remember is that breastfeeding is a journey, not a destination. It may take time to figure things out, and that's okay. Don't be too hard on yourself if you encounter setbacks or difficulties along the way. Instead, focus on celebrating your successes, no matter how small they may seem. And remember, you're not alone. There are many resources available to help you along the way. To wrap up, remember that breastfeeding after a C-section is a journey that requires patience and support. You're not alone in this. You got this, Mama. If you found this information helpful, please check out my other videos on postpartum care and share your thoughts in the comments below.